From This Corner with John Ball is brought to you by KNEO 91.7 The Word.
Good morning, I'm John Ball, and this is From This Corner. I have Newton County Health Director Larry Bergner with us. And Larry, boy, I tell you what, this pandemic just keeps going. It seems like we go 2 steps forward, a step backwards, then another step backwards, and then a step forward. So what's going on with your department? You guys are really busy, aren't you?
We are staying busy with COVID, and I feel like we take a couple of steps forward and then we go a couple of steps back, and there just doesn't seem to be any rhyme or reason as to the numbers. I gather information daily as to where we're at, and the last couple of days we've had about 29 new cases on the 6th and the 8th, and on the 5th we had 51 new cases. So we went from 51 down to 29, and I hope that we can get to a point where we have the new cases ideally below 20 would be nice, and even below 10 would be super. So hopefully we'll get there soon. But our active cases, we're not doing horrible. We're at 360 active cases. Our high was 423 July 22nd. On the 6th, we had 331. It seems like I have contact tracers, a group of contact tracers, and we'll see a bump over the weekend, and that's what the 360 is our weekend bump. As I get contact tracers and working with those who are positive, and there'll be several released off of isolation, and so we'll see those active cases hopefully go down this week, and I'd like to see them back in the mid to 250 or below range.
Well, I tell you what, kind of piggybacking on the last time you and I talked, personal responsibility is paramount. And the person gets isolated, they probably need to stay isolated, which means stay home. Don't go out, don't go to Walmart, maybe not even go to church to a certain extent. Don't get anybody to think I'm saying don't go to church. That's not what I'm saying at all. But be real careful and use common sense, right?
That's exactly right. When you're a positive case, you are having symptoms, or maybe you're asymptomatic, but you have coronavirus. So you need to stay out of the public. You need to stay isolated at home for 10 days and then talk to us or your primary care physician to make sure that your symptoms are disappearing and that you're feeling much better, and get that release, that official release from either the health department or your primary care physician. But certainly we don't need to be out and about when you are a positive case. That is exactly right.
All right, let's dispel one myth here real quick. Wearing a mask does not protect me from anyone. It protects everyone else from me, right?
That is correct. That's the information that I'm constantly seeing, is that when you wear a mask, you are protecting others from yourself, not you from others. So, and that's why we continue to say everyone should wear a mask if they cannot social distance, because if everyone is wearing the mask when they are in a gathering, then everyone is protecting everyone from themselves. We want to continue with that social distancing and wearing the mask. It helps protect each other, and so that's where we want to go to see these numbers start to decline.
Okay, well, thank you very much. Hey, it is coming. The holiday season, people are going to be on the road, they're going to be traveling, there'll be family gatherings, probably people you haven't seen in a long, long time. Have you got some common sense things that we might be able to use as guidelines to help us during those type of gatherings?
Yes, it's hard to, as we look for Thanksgiving and Christmas, we are so used to having family gatherings, and I don't want to be the Scrooge that ruins the Christmas or the Thanksgiving holiday, but our positivity rate right now in Newton County, we're running about 26 to 27% positivity rate. And so you're about 27% likely to be positive if you were to be tested. So with that in mind, if you have people coming from different locations, you run a much higher risk of getting COVID. And so the least amount of numbers or people within your immediate family that you've been around is a much better scenario. But if you want to gather, that's certainly, we all are wanting to be with family, but those social distancing still should apply. And just be very careful and recognize the fact that the numbers are going up. It is in the community, the coronavirus, and there's a pretty high positivity rate. Over the span of this since March, we're at about an 18% positivity rate. But within the last week, and I've seen this weekly here for the last several weeks, we're running about between 26 and 27% positivity rate currently. So be aware of that, and social distancing needs to apply. If you're at high risk or you have a family member that's at a high risk, I hate to be the Scrooge, but it might be better to not get together in person and wait until we get a vaccine or the numbers start to go down quite a bit before we put some of our family members at a higher risk.
TV this morning said that there were some pretty positive things for us to look forward to with a vaccine. Is that what you've heard?
I have heard. In fact, this morning I read just a headline that one of the companies that are working with the vaccine, so far their vaccine seems to be about 90% effective. So I think we are going to have a vaccine soon, and hopefully before the first of the year, but if not, shortly thereafter. And I think it's going to have a pretty high effective rate, so I'm excited that we are on the verge of a vaccine. And once that's out, we'll start with those who are in our nursing homes and those who are at higher risk to get those folks protected, our healthcare workers also, because we need them protected so that they can take care of others. And then we'll kind of work through probably in 2021 getting all of our public immunized against coronavirus, and hopefully at that point get back to what we are used to as normal. So I'm very excited about the fact that we're getting closer.
Okay, not to be redundant, but I think it's really important. Those people that are suspect, that meaning that they have a higher chance of contracting the coronavirus, are people over 60, people with diabetes, people with heart problems, and people with immunization problems. Is that right?
That's exactly right. You have hit it right on the head. Those who are 60 and above with those conditions need to take precaution and be aware and not be mingling in a large gathering, or like say even Thanksgiving might be a time to say, well, let's wait a little bit to get together with family so that we don't come away and have some of our family members get sick. Unfortunately, I've read so many instances where family gatherings is the place where many are getting illness and some are becoming very, very ill, and it's been because they got together with family, and that's unfortunate. And again, we know family is dear to us all, but we want to take every precaution to keep our families protected.
You bet. As we talked the last time, the guidelines are stay away from someone, meaning more than 6 feet away, and don't be in the presence of anyone for more than 15 minutes at a time. And my own thought is, because I like to be outside and I like to walk, if you go outside, the air turns over a whole lot faster than it does when it's stagnant air in a room, right?
That's exactly right. You're much less at risk being outside than you are being inside. So some of the guidelines I'm reading from CDC, even with family gatherings, is if the weather's nice, have that family gathering out on the back patio, out in the backyard, set up some tables in the yard so that you can be outside, because you do have much better airflow and more of an opportunity to keep that 6-foot distance between folks. Always good to put yourself in the least at risk that you can, and so by wearing the mask, if you can't be at 6 feet distance, wear the mask, but being outside also helps greatly.
All right, once again, we're talking with Larry Bergner. Larry is the director of the Newton County Health Department. Larry, if someone's got questions, they can be directed to your website. Tell us what that website is, and then tell us what a phone number is to contact you all.
Our phone number is 451-3743, and you can look us up at newtoncountyhealth.org, so newtoncountyhealth.org, or give us a call at 451-3743. Be glad to answer any questions that you might have, and we appreciate working with the public and the support of the public as we go through this pandemic.
Well, Larry, thank you so very much, because you're one of those guys that kind of takes a common sense approach. You've got your eye on everything. You look at the data. Let me be among the first to wish you and your family a very Merry Christmas and a prosperous New Year. In fact, that's what we all want, right?
That's exactly right, and I wish the same to you and yours and to all of our community. We hope to get through this very soon, and please stay safe, all of you out there.
Thank you, Larry.
Thank you.